Virginia health authorities have set their sights on tracking the impact of cannabis consumption in children. With the legalization of cannabis possession for adults back in July of 2021, it's clear that the state sees the need to monitor the potential risks of THC and CBD may pose to younger individuals. This new surveillance system by the Virginia Department of Health will keep a close eye on the cannabis-related incidents involving children. Since legalization, more than 500 cases of cannabis ingestion have been reported in children, up from just 150 cases in 2020. Dr. Chris Hostelage, who directs the Blue Ridge Poison Center at the University of Virginia, noted that many of these kids are inadvertently consuming THC-infused edibles disguised as innocent-looking candy. He emphasized that protecting public safety should be a priority given the rising accessibility of cannabis edibles. He says, we want to make sure that these products are being sold. We're selling them in the best way possible to keep the public safe, both adults and children. The governor, Glenn Youngkin, vetoed a bill earlier this year that would have created a regulated cannabis market. He said, the proposed legalization of retail marijuana in the Commonwealth endangers Virginians' health and safety. Attempting to rectify the error of decriminalizing marijuana by establishing a safe and regulated marketplace is an unachievable goal. Virginia's authorities are urging healthcare professionals to report any cases of cannabis-related hospitalization among minors or cluster cases impacting multiple children. This is part of the new initiative, which also invites the public to use an online portal to report such adverse effects. Users are prompted to share detailed information about the products, such as packaging, purchase date, and place of purchase. This new system is rooted in the VA Code Section 8, requiring reporting of suspected or confirmed cases of diseases and effects to state authorities. The goal is to gather vital data to better understand how products containing THC and CBD affect children. But it's not all about tracking the impact. Dr. Hostelage had highlighted the importance of transparency in labeling to ensure people know precisely what they're purchasing, particularly given the concern over undisclosed substances like Delta-9 THC, which is legal in Virginia's marketplace. Dr. Hostelage went on to say, it's also a question of if they're selling CBD products, is there other substances in there, other cannabinoids like Delta-9 and THC? On top of his surveillance effort, the Division of Consolidated Laboratory Services will provide testing services to help determine exactly what's in those products. Now, as far as my take on the matter, sure, it's concerning that kids are getting into these products, but this feels like we're seeing a cocktail of factors at play here. The problem isn't that cannabis edibles look like candy. No, this is part propaganda, stirring up hysteria, part poor parenting, leaving things out for little hands to grab, and 100% a lack of proper education on cannabis from top to bottom. The governor, who's against decriminalizing cannabis, is clearly a prohibitionist, and his boneheaded move to veto a bill that would have regulated the retail sale of cannabis products only worsens matters. His statement alone, where he said, attempting to rectify the error of decriminalizing marijuana by establishing a safe and regulated marketplace is an unachievable goal. It's one of the dumbest things I've ever heard. This is exactly what you need to do now. You've decriminalized, so now why wouldn't you not want to establish a safe and regulated marketplace? We need to standardize how the plant is presented to consumers and make sure the message gets through to lawmakers, parents, and children alike. Without proper information, the situation remains muddy, and kids will continue to stumble upon treats that are much more than sugary sweets. Don't be a dumbass. Lock up your stash because your careless stupidity only helps the Kevin Sabets of the world. I'm Stone Slade reporting for the High at 9 News.
Oh, Rico, I can't wait to hear what you have to say about this, Rico, your home state.
Yeah.
It's more Virginia bullshit coming from your boy, Glenn Youngkin.
Glenn Youngkin, that's right.
And I love how Happy Glass put in the comments here. They ain't tracking Tylenol, sickness and deaths.
Yep. I'm sure that they track it.
You gonna let people track your kids all around the world?
The CDC tracks all of this stuff. Like when you call in a complaint for your kids.
This is a perfect example. I think this is a perfect candidate for that slippery slope argument. Right, like kids are going to the hospital for what? Like, should you not be tracking every time kids go to the hospital? Like whether they slip up or they crash their bike, whatever. Like you're gonna take away that bike? No, you can be tracking these parents. That's what they're getting to, man. And that's what I see long term. They're going to be tracking the parents, and they're going to try to attack the parents.
Oh, they're definitely going to do that.
If any of these kids
They're definitely going to do that.
You're going to have people just stop taking their kids to the doctor because you're going to think people are going to be tracking you. It's going to cause paranoia. So it's more bullshit coming from Glenn Youngkin. That's my thoughts.
Any thoughts on this, Tony? Elise? You guys?
I think that the where these people fail at is they're always trying to tell you what you can't do and instead of, I believe, trying to figure out how you can allow responsible adults to be able to govern their own households, create legislation that punishes the parents as derelict in duty. And when your kid is using your stuff and it's found that you're not putting it in a proper place, you're not educating your kids on why it's not important for them, if you're not doing it in a way where your kids don't really understand, it can be like a cigarette or not even. Some people don't even smoke cigarettes around their children. But instead of them trying to work with the actual people who are giving them money, giving them opportunity to feed their families, they just all around. I just think that they continue to drop the ball. There's always an excuse. There's always going to be an excuse. When you hear stuff like this, there's no wonder why. There's always somebody who's going to say, but your people are doing this on this side.
Mm-hmm. I just feel like we need to just say, make parenting great again, and we need to drop all this nanny state BS that's happening from both sides.
Well, I think
what happened to no seatbelts?
A kid can, take their parent's gun, or, how many kids die because of guns, and no one's trying to take those away. But, oh, God forbid,
they
these,
shouldn't.
plant-based edibles.
They shouldn't
so
take guns away.
No, don't take no guns away.
Yeah, no.
I'm not saying that we should. I'm just saying it's ridiculous that they want to take away our weed. And
I agree.
I'm pretty sure more kids go to the hospital or die over guns than weed, is all I'm going to say.
Most definitely.
I don't know. I don't know about all that. I don't know about.
Yeah, I would say alcohol poisoning probably kills.
Yeah, I would say probably more alcohol poisoning and even chemicals underneath the sink type of thing probably kills.
Yeah, that type of stuff. Yeah. I don't think that. I don't think that kids is just going around just indiscriminately shooting each other outside of one particular place I can think of.
Yeah.
Really? We don't have a mass shooting issue in schools?
Mass shooting means anything more than 3, just for a clear definition, okay?
And because it's a high term. And we're talking about something that doesn't happen like every day. When you say, okay, look, over 700,000 people die every year from pharmaceutical mishaps, meaning there are drugs that is produced that ultimately unalives people. Mm-hmm. And it's up to 700,000 people every year. This is an average. We can't say that about firearms in terms of children taking them from their parents' house in the house and just offing their neighbor or something like that, because it is nowhere near an equivalent.
Not even close. Not even close.
It's easier to get it done in some states than it is to get weed for a kid.
Say that again, please.
And the statement she made was that more kids die from guns than cannabis, which is 100% true.
But it would have to be, though, Stone, towards their parents' gun, because we're talking about someone getting their parents' weed. So it's not like we're saying, because we're not just saying kids going to get weed from the weed man, we're saying from their parents. So that means that kids would have to use their parents' gun. Go, hey, neighbor, bang, that's it. Like, I'm saying that's...
Still, more kids have died from that than cannabis.
Of course, no one dies from cannabis.
No one dies from cannabis. No one's died from cannabis. We all agree.
No one dies from cannabis.
That's cute. That's cute, Stone.
I
see what you're doing there, Stone. I see what you're doing there. That's not really what she was saying, but that's cute.
That is what I was saying. We all agree.
No. We all don't agree. Just
I don't know.
Okay.
It's okay. You can say that she was right. We can move on.
I think you guys get caught up on some BS. Like, I never said I was trying to take anyone's gun away. I'm just saying that I think it's ridiculous that certain parties are more concerned about taking away or blocking access to cannabis and claiming that that's more dangerous than the accessibility to guns. And I will say it again, that in some states, it is far easier for a child to access a firearm or a gun than cannabis. And that's
probably only because their parents don't smoke, though, Elise.
I mean, we were just talking about a story where you can get Delta 8 at a gas station. So apparently you can get these scary drugs and things anyway. And that's the problem for people.
In Illinois,
an adult at a gas station would still have to sell it to the minor.
Oh boy, you guys are.
I feel you, Elise.
Yeah, we do. We feel you, Elise. Your heart's in the.
We got your back, sis. I feel what you're saying. I understand.
Your heart's in the right place.
We got you.
We love it.
You're not saying ban the guns. You're saying I get you. We got you.
I love guns.
Yeah, she loves. Rico,
I enjoy
Rico, we're gonna
anyway.
keep this train. We're gonna keep this train.
Even the most ardent gun prohibitionists, once you shoot a gun, man, your mind changes a little bit.
You popping off.